Today we have with us Dr. Ashwani Garg. Thank you, Dr. Ashwani, for joining us from Bangalore.
Thank you, Dr. Karthik.
Very brief introduction about Ashwani I would like to give you. He's been a conventionally trained doctor in allopathic medicine who's been practicing functional medicine for the past 8 years. He's been instrumental in setting up India's first association of functional medicine. He co-founded it along with a couple of other doctors. His passion is trying to get to the root cause of all the chronic disease management, and in particular, his specialty area, I would say, is considered autism and autistic spectrum in children. And I would like to know a bit more about that from Dr. Ashwani today. Before I do that, can you tell us a little bit about how you ended up in functional medicine?
Sure, sir. So it is interesting. In the medical books we read, we the day we are born, the disease starts in the system, and the disease is sort of inevitable. Is what taught to us, and we practically see people. Not everybody die of a disease. Of course, we can put a label later on, but a lot of people die in a healthy. So, not necessarily we all, might not get a disease. That's the so this concept of that we are born to get disease is sort of unsettling for me, and for that reason I always kept looking what is the better answer, what is the better way for us to keep healthy, or even if we get a disease, how do we fix it rather than manage it. So this has led to me to this
No,
journey.
it's very nicely put. How to fix it is the thing what we are looking for. How to fix it. To know how to fix it, you need to get to the underlying root cause of the problem. Managing it comes afterwards. So, in your area of specialty or other things, what all do you do apart from autism? What are your core area of interests which you do? And if you can elaborate a bit more on each of those areas with the focus on your specialty area.
So broadly, I would say we help to make people healthier. Okay. Now people come to us with autoimmune problems. People come to us with autism, of course, and autism spectrum disorders. People come to us with skin problems. Of course, longevity. People are coming to us nowadays. Now, at the end of the day, all whatever we are trying to do is to find out what is wrong currently in the body, and what are the strategies in terms of diet, lifestyle, water, sunlight, how do we make their microbiota healthy, how do we make their mitochondria healthy, to eventually disease start going away and health start coming in. So for us, doesn't matter what is the label that they carry, we just want to make them healthy. So we work with all kind of chronic problems, but large focus is on to autism, and because it's a very problematic area currently.
So, what do you say? I mean, in your things, I know in general, we know the incidence of autism has increased ever since we were in medical school. But what is the current sort of incidence and prevalence, and what are the risk factors we are seeing? What are actually the risk factors in mothers or in the common community, which is actually leading to this increased case flow?
In India, we still don't have the good numbers, but US they say almost 1 in 60 is getting some level of problem. So India is no less than Western countries. Indian lifestyle, Indian exposure to technology, etc. for a child is becoming as in the West. So the risk is almost same. Though numbers are not so concrete, but looking at the problem, it looks very scary. Now, what are our observations, which probably give us some clue? Now, when a mother starts a treatment for the child, okay, typically they tend to start their own treatment also. Now, when we see these mothers are having some autoimmune problems already. Some of them have lichen planus, some of them have psoriasis, some of them have Hashimoto. So, if mother health is already compromised, or autoimmune, or some level of infections are going on in the mother, that becomes a major risk factor.
Is this, can I just briefly interrupt? Is this undiagnosed autoimmune or infections, or is it diagnosed but not treated?
Most cases diagnosed,
Okay.
but again, let's say psoriasis. Typically, a mother is put on steroids for it, or let's say some immune modulator. So, mother's immune system is pretty compromised
Okay.
during this thing. And one of the things that we have observed, a lot of this eczema, psoriasis are driven by fungal infections. And a lot of autism is also one of the driving factors, fungal infections. So probably microbiota get transferred from the mother to the child, and child is predisposed to the problem at the birth. Maybe They're not born with the problem, but they're predisposed because of the microbiota disturbance of the
So
mother.
this microbiota disturbance you're talking about, is it compromised right at the birth for the child itself? And do you see an increased disturbance in microbiota in children born by cesarean section versus normal delivery?
Yes, we do collect the data, and many of these children who are born, they are diagnosed with the problem. Either they are born through a lot of force this pregnancies, for example, IVF and all that. Mother health is compromised. Of course, many of them are born through C-section, where we can understand that they could not get the right microbiota. And many of them, the mothers would tell us, and when we ask the question, they have undergone multiple rounds of antibiotics. So this certainly means, when we take antibiotic, we know for a fact that it bring down all the good and the bad guys and the bugs in the gut. So fungal infections and all of these guys start growing. So all of them have a lot of fungal infections when we test.
What do you think about the parasitic load in such patients?
So that's very, very interesting. So if today you ask me, many of the symptoms are very, very linked to the parasitic infection. So they keep licking on walls, they eat sand, they don't sleep well. During full moon, their problems are much exaggerated. And we know for a fact that during full moon, the parasitic activity is heavier in the body. Even though load is there, but they become more aggressive in and child becomes more aggressive. So they eat a lot of food. So a child of 4 years might eat like an adult. So where is this whole food going? So it's a very typical of parasitic this thing. They can chew on steel plates, for example. Sometimes mothers would bring a steel plate and my child is chewing. They can break their teeth because of that. Now, we think it is a behavior of the child. They tend to spit. They tend to push others. They tend to chew or bite others. This is very, very typical of the parasitic infection in the body. And many of them, when we look at them, there's no absolute right way to test these parasites, but at least the eosinophils gives us a lot of clue. So eosinophils keeps high in many of them. And when we deworm them, very, very aggressively, we have to deworm them. Many of these symptoms start settling down. So the very, very direct correlation of a heavy parasitic activity in their children.
And when you talk about deworming, when you deworm the child, do you tend to use your conventional medicines, or is there any other medicines what you would use? And would you deworm others in your family as well at the same time?
Now another interesting things that we see with these children, typically their toxic burden is very heavy. Okay, the lead might be heavy, their aluminium, the mercury, all of these toxic burdens. Some of them we are able to test, some of them we are not able to test. Now, interestingly, there's some school of thought they say because the toxic burden is heavy, that is why parasites are there.
Okay.
So now we don't straight away get into antiparasitics. We want to clean the terrain. We want to clean these toxins from the body. Then we keep cleaning these parasites. So this is typically, we don't, if we straight away get into killing the parasites, probably parasite will bust all the toxic waste will go to the blood and it can be dangerous for the child. So simultaneously we have to do that. Yes, we build the immune system, that is very, very important. We make sure gut is moving, that is very, very important. Otherwise load will not come out. Then building the immune system and cleaning the gut. Then we get started with the antiparasites. So we use conventional drugs also, albendazole, bebendazole, tinitazole. Then we use herbs also, have a broad spectrum coverage. We don't know which ones are there. So as much as broad spectrum coverage we can give to them. So there are good herbs like wormwood complex we get from US. So that has few herbs. Artemisia is one of them. And Indian Ayurveda has a lot of good herbs.
Excellent.
So we are just trying to use a combination of them and slowly, gradually. Now, load is so heavy, it can take months to years to clean it. So we continue our process slowly, gradually.
So these these herbs, do they help offload the heavy metals as well, or heavy metal offloading is something different you're using?
Yes. So now, interestingly, when we test these children, the liver is compromised most of the time. The OTPDs will keep high most of the time. Their nutrition status is very, very poor. For example, their B complex, their proteins are low, their good minerals, magnesium, zinc. So pretty much this all nutrition is required, even the detox to happen. Or liver is to be in a good state to detox to happen. So first thing we want to work on the basics, make sure. And second, we don't want to feed these infections. That's another, people get angry that why are we taking those strict measures of diet? My child should be a child. He should be allowed to eat ice creams and all of that. But we have seen if we feed a lot of these unhealthy foods, we're not feeding ourselves. We're feeding these infections also. We have to stop the feed to the infections, and we have to prepare the body with the right nutrients. Then we get into detoxification. So first level, we use supplementation, probably lipoic acid, probably NAC, or glutathione. Of course, we can test them, what is low, what is high, based on the metabolite test. Then next level, we get into chelation. We use this glutathione suppositories. We use EDTA suppositories. We use DMSA. These are all nowadays considered as a nutraceuticals only, which is very, very safe. Typically, we haven't seen, but we go low dose.
And all in a suppository form.
Most of them suppository form, because children, 3 years, 4 years, 5 years, hardly any ways to do that. Now, next interesting thing that we have started doing is something called scalar detox. Now, typically, it's like homeopathy. It's like water imprinted with certain frequencies, a frequency of lead, a frequency of aluminium, mercury, or microplastics, or let's say antibiotics. So we want to detox as much as so. Something we can test, something we cannot test. So but we are making this homeopathy remedy in a way which call it scalar detox machine, which can imprint these frequencies. Then orally or through a laser. Okay. So this bottle with this frequency and laser. So we put it onto the certain parts of the body. Then intracellular detoxification start happening. Okay. And interestingly, after doing that, the toxic burden in the blood will increase.
Okay, because it all comes into the blood to be excreted.
Yes. So then sometimes there's a die-off reaction, there's a detox reaction, all of that happening. But yes, as toxins will move out of the body, body start going into repair. So now when they come to us, the problem, the infection, the toxins, and the lack of nutrients, the body in the drive to sort of a damage or inflammation mode. So more damage is happening, less repair is happening, which naturally body should be repairing. So as we prepare the body, damage gets low, and body goes into repair. So then the child starts recovering.
Is there any healing crisis you see during these kind of phases?
Yes. So
what happens during? How do you handle them?
So typically, again, it's very, very difficult to find out whether it is a problem, existing problem, or because of what we are doing, some exaggeration of that. Now, we don't know, but these toxins might be sitting in the cells. Now, we want to pull them out. Blood is always the best biochemistry. Now, when body cannot handle these toxins, body will deposit in the tissues. Now, we are pulling them out of the tissues in the blood before it comes out. So when it goes up, then maybe regression sort of seemingly happening.
Transient.
But
it's transient.
Yes. So we start the basic diet, the basic parent is happy, things are happening. This is great. Then we go a little aggressive because it has to be happening. It has to be removed.
Yes.
Then they say, my child from non-verbal to have become verbal. Again, some loss of abilities is happening. Then we keep telling them, it's fine. It's just a transient. Then every time a detox happens or reaction happens, child comes out more stronger.
Absolutely.
But a lot of time, because practitioners are not aware of this fact, a lot of homeopaths do a lot of work in autism, or Ayurveda practitioners do a lot of work in autism. Till the time things go okay, everybody's happy. When detox happens, crisis happens, nobody knows what is happening. They think treatment is doing wrong. Actually, treatment is working what is supposed to be doing.
That's why it is happening. That's why the crisis is happening.
Absolutely, sir.
So another thing is roughly, if you say you start seeing a child by the age of 3 or whatever it is, average age, how long before you are able to say that's the end of treatment, we are drawing line and he's back to mainstream school or whatever?
Right. So putting the right numbers is difficult because the starting point could be different for every child.
Each one, yes.
But typically, I would say that if a parent persistently work with for a year to year and a half, we can say most of the symptoms can regress. Most of the problems can regress, and child can become as normal as anybody else. For a, let's say, 3-year, 4-year-old child. If a child is 6 or 8, then probably a little longer. Now, it is assumed currently because it is thought is a behavioral problem. There's no systemic problem in the body. There's no biology which is affected in this children. It is assumed. They think it is a status quo maintains. If a child is today is mild, at 6 it might stay mild. It is not like that. Most cases, as the child will grow in the age, biology defects will increase. Let's say infections or toxic buildup or deficiencies. As they increase, the mild can become severe or moderate or even worse. So typically that we see. So if a child at a higher age comes to us, it might take longer time for that because problem is high.
Now, one more thing, when they come to you for these therapies, or any functional medicine practitioner who's aware of these therapies and they start their process of offloading the toxins and parasites and so on and so forth, do they continue with their other therapies what they're undertaking at the moment? They usually go to their speech therapy and other things they'll be going.
So typically, we never stop anybody from doing anything they want to do. But my question is, it's more of a trainings, right? Occupational therapy, ABA, or these are speech therapy. Predominantly means they want to train my brain on something. Now, if my brain is underdeveloped, my brain is having not having enough mitochondria. Doesn't matter how much hard you try to train me, I'll not pick it up. But if my brain is repaired, my body is repaired, then you tell me for once or twice, I will anyways pick up. I don't need so much repetition. So I say first repair your body and brain. Then you do as much as training you want to do for your child. Anyway, schools and homes, every parent is training a child to become a better human being. Right? So my focus is always make the body healthy. This is healthy, so I can pick up the signals. I can pick up the nuances of the society. I can anyway learn from the environment that we are supposed to be learning.
One thing which is very close to my heart is the diet, the millet form of diet to this particular condition, autism and autistic spectrum. What is your take on that?
So predominantly we say millet diet to everybody. Now, why I'm saying this? White rice good for nothing. So no protein, no fiber, no nothing. It's very, very plain. Now, it might not be antigenic because it's just a carbohydrate, but it feeds the infection. All of them has already, many of them have eczema, many of them has itching in their private parts, so primarily due to the fungal infections. So if we feed them white rice, we're feeding the problem. So it becomes very difficult. Gluten, for sure, we know it causes condition called leaky gut. And they become, and many of them have autoimmune markers high, ANA high, NTCCP high, many of them. So by removing gluten, we ensure that leaky gut is taken care and inflammation comes down. Milk, again, we don't even know it's milk. A lot of the milk that is available in this country today is adulterated, that's one. Second, it comes from the hybrid cows, and the milk itself become hybrid, and the human system or immune system is not recognizing that, it starts making antibodies against it. Third, it is pasteurized. Fourth is coming in the plastic package. So by the time this milk is on the table, is something else. So we want to avoid that. Any possibility. Now, camel milk, goat milk is fantastic. Now, my gut, 90% of them have a very, very poor gut health. Now, one of the reasons is infection. So we want to kill these infections and we want to regrow healthy or repopulate healthy guys. And prebiotics are very, very important. So millets, every different millet, 5 of them, the positive millets, each of them will bring a different fiber, and we improve the diversity of the microbiome by feeding these fiber. Thereby, gut brain axis, and there's improvement in the autism.
And again, you mentioned briefly a timeline of it takes 18 months to 24 months for the gut microbiome to reboot itself. And that is exactly the length of time you're saying that it needs for the treatment, for the rest of the treatments to work as well.
Yes. Now, as the science is progressive, today we are in a stage we say autism is a mitochondrial dysfunction. And mitochondria is also a bacterial cell. Right? So definitely our microbiome is affecting the mitochondria. If our gut microbiota gets healthier, our mitochondria indirectly gets healthier, and that metabolic activity becomes much better, and then as a consequence, the speech and the cognition and the learning and all of that gets better just by improving the gut microbiota.
And with the gut microbiota, your focus is more on prebiotics as opposed to probiotics, or is it a combination of both?
Right. So we also have learned the hard way. Initially, we thought we can give both kefir and kombucha and buttermilk and all of that. But we realized that when infections are heavy in the system, we don't want to give too many probiotics. These are life strains, right? We, even though we might have some control on which ones are we growing, but there's some concept called pleomorphism. So one strain can turn into another. We don't know what is happening. So first goal is to reduce the infection load or reduce a number of the microbes. Then use specific strains in supplement form, targeting specific infections. Now, once that is settled, and importantly, if immune system is compromised, and if I load a lot of microbes in the form of probiotic, and my immune system is compromised, nobody is there to check that.
Yes.
The same guys can turn out to be negative. We don't know.
Yes.
Right? So rather, I would reduce it, make the immune system better, make the gut better, make the leaky gut more sealed. And once the symptoms are stable, once the markers are good, then they can go on a regular probiotic drinks. But till then, very, very specific probiotics you want to use.
Parents who are carers of these children are probably working parents, probably at home. They've got high pressure jobs. Even without working, they'll be under very stressful conditions. Do you have part of a team, a counselor or a hypnotherapist or somebody like that who can take care of these scenarios? And what are the most common difficulties the parents face?
Right. So the first question is, now typically what we see, parents who are more anxious, who are unsettled, the child will also have similar issues. So now we're realizing my energy will affect my child also. So if parents has to be in the right frame of mind and energy to heal the child. So in case parents wants, we send them into energy healer, a Reiki healer or energy healer. And these healers are very, very smart. They can look at you and say, these chakras are not good, and they can work upon that. Right? So because your energy as a parent should not affect your child's energy. Yes, this work of resolving autism is very, very tough. Right? It is so considered as irreversible or a problem for disease, life. But if we work upon that, parent really has to buckle up. Really has to buckle up. Okay? And probably one of them might have to give up their job also. Because if we don't fix it today at early on, it's a problem for life. Only, I think they say 10-15% spontaneously might recover. 80%, 85% of them will continue to have a disease or severity can increase. So really they have to do what they have to do. Challenges are there. Food becomes a challenge. Lifestyle becomes a challenge. We ask them not to take a lot of Wi-Fi, remove gadgets, screens. That becomes a challenge. But I realize if a parent is committed to fix the problem, they can really do it.
Excellent. I think it's a lot of excellent information you have shared with us today. Is there any bits you would like to add on to sort of help viewers who are watching this, either the family or the relatives of the children, autistic children?
Right. So I think first of all we have to recognize one thing: it is not a behavioral problem per se. Behavior. They have a lot of varied behaviors. It can be very, very annoying, but a lot of time child is not doing on purpose. Child is doing because there's a pathology. For example, there's a toe walking. They think it is some behavior, and for no reason this guy is just walking on the toes, and let me correct them behaviorally. And you force them, no, walk on normal, walk normal. Unfortunately, oxalates are very, very heavy in there, and they typically deposit into the feet, and they're under tremendous pain.
That's why they end up walking on their toes.
Yes. And how are we getting these oxalates? Because fungal infections are there. So one of the byproduct, the metabolite of the fungal infection is oxalate, and they deposit. And interestingly, this sodium bicarb, which is ENO.
Yes.
If you feed them, ENO will help eliminate these oxalates easy. And over a period of time, they start walking normal. So the problem is not the behavior. Problem is the underlying pathology.
And we have to understand that pathology. The physicians or the pediatricians or the counselors or the teachers, for that matter, in the school. They need to be aware of these things. And
yes. So as a parent, please be humble with them. Don't force them on anything. They're not doing anything on purpose. Their body is under tremendous pain. They don't sleep not because they don't want to sleep. They cannot sleep. The melatonin production is compromised. We don't take them under sun. We don't get enough sunlight. We don't mix melatonin. We don't sleep. They have parasites. As the moon comes up, parasite activity becomes heavier, and these guys are at night. They're active and running around and anxiety and crying and hungry. All of that, not because they want to do it. So if we, as a parent or as a society, as a medical professional, just observe them, and see why this child is trying to do what they're trying to do, we will have all the answers on the plate.
Fantastic. Thank you so much, Dr. Ashwani, for such an insightful discussion on autism and related things. Thank you very much.
Thank you, Dr. Karthik. Thank you. Thank you.